Hello and welcome to Care Conversations, brought to you by Nurse Registry. This is your trusted space for straightforward and useful health topics that matter the most to you and your family. From managing chronic conditions to understanding what quality nursing care really looks like, we're here to empower you with knowledge that makes a difference. I'm glad you're here. Let's get started. Today, we're going to talk about something that might seem straightforward, but actually confuses a lot of people: the difference between a surgery and a procedure. Now, you might be thinking, aren't they the same thing? And honestly, that's a completely fair question, because even healthcare providers sometimes use these terms interchangeably. But here's the thing: they're not the same, and understanding the difference can dramatically impact how you prepare, what you should expect, and how long recovery will typically take. If your doctor has ever told you you need a procedure or you're going to need surgery, and you walked out of that appointment feeling a little bit confused about what that actually means, this episode is for you. We're going to break down the fundamental differences between surgical and non-surgical interventions, talk about where these treatments happen, discuss anesthesia options, look at recovery timelines, and give you practical guidance for making informed healthcare decisions. Because here's what I believe: when you understand what's happening, anxiety decreases and your ability to prepare effectively increases. Knowledge transforms uncertainty into manageable expectations. So, let's dive in. All right, let's start with the fundamental distinction. Here's the key concept to understand. All surgeries are procedures, but not all procedures are surgeries. Kind of like the squares and rectangles thing, right? You know what I'm talking about. So think about it like this. Procedure is a big umbrella term that covers all medical interventions. Underneath that umbrella, you have surgical procedures and non-surgical procedures. Surgery represents a specific type of procedure, one that involves invasive techniques requiring incisions, tissue cutting, or manipulation of internal organs. Surgery is what we're talking about when someone is literally cutting into a body to fix something. Now, procedures, on the other hand, encompass everything, both surgical and non-surgical interventions. This includes diagnostic tests, therapeutic treatments, injections, imaging studies, and also surgeries. So when your doctor says you need a procedure, they could be talking about anything from a simple blood draw to a colonoscopy to open heart surgery. That is why it is so important to ask for clarification. The classification system isn't just medical jargon. It directly affects your daily planning. Non-surgical procedures typically allow same-day return to normal activities. You might go in for a procedure in the morning and be back at work in the afternoon. Now, surgical interventions, those may require days or weeks of recovery with significant activity restrictions. Your work schedule, childcare arrangements, how much help you'll need at home, all of this hinges on whether you're having a procedure or a surgery. So let's talk about procedures first, the non-surgical kind, because honestly, these are much less intimidating once you kind of understand what they involve. Medical procedures are minimally invasive or non-invasive interventions designed to diagnose, treat, monitor, or examine various health conditions without requiring large incisions. Here's a couple of common examples. Colonoscopies, which examine your intestinal health using a flexible camera. Cardiac catheterizations, which assess heart function through small access points in your arteries. Endoscopies, where they examine your stomach through your mouth. Some wound care, joint injections, even cataract removal. All of these are procedures, not surgeries. Now, what makes procedures less intimidating? Well, there's several things. First, there's minimal tissue disruption. We're talking very, very small incisions or maybe no cuts at all. Second, they typically happen in outpatient settings, doctor's offices or ambulatory centers. You're not checking into a hospital. Third, recovery is typically fairly quick. Most patients resume normal activities within 24 to 48 hours. Fourth, complication risks are lower. There's reduced chance of infection or significant side effects compared to surgery. And fifth, anesthesia is limited. You're usually getting local numbing or very light sedation instead of being fully unconscious. All right, now let's talk about surgery because this is where things tend to get a little more serious. Surgery involves invasive medical interventions requiring incisions, tissue manipulation, or internal organ access. These are performed in sterile operating environments with specialized medical teams. Surgical treatments address conditions that procedures can't manage effectively. They often provide definitive solutions for complex health problems, but they come with more preparation, more risk, and unfortunately, more recovery time. We can break surgeries down into a few categories. Minor surgeries include things like tonsillectomies, hernia repairs, and appendectomies. These typically require general anesthesia, but you might go home the same day or just stay overnight. Major surgeries encompass things like organ transplants, joint replacements, and cardiovascular surgeries. These require extended hospitalization and comprehensive recovery periods. We're talking like weeks or months, not days. Then there's the distinction between emergency and elective surgeries. I know we're getting even deeper into it. Emergency surgeries address life-threatening conditions requiring immediate intervention. Now, elective surgeries treat non-urgent conditions on scheduled timelines. The urgency affects how much time you have to prepare and plan. Surgery is also highly specialized. Orthopedic surgeons handle bone and joint problems. Cardiovascular surgeons address heart and blood vessel conditions. Neurosurgeons treat brain and nervous system disorders. This specialization is actually a good thing because it guarantees that your surgical team has extensive training and experience that is directly relevant to the specific condition at hand. Now, here's something that matters a little more than you might think: where your treatment happens. The location directly correlates with how complex and serious your intervention is. Outpatient settings accommodate most procedures. This includes physician offices, ambulatory surgery centers, and specialized procedural suites. These environments have necessary equipment and monitoring capabilities, but they're designed for things that don't require overnight stays. If you're having something done in an outpatient setting, that's generally a pretty good sign. It means the medical team is confident you'll do well and you can go home shortly after. Hospital settings are reserved for surgical interventions that require comprehensive medical support, emergency response capabilities, and extended monitoring. Operating rooms provide sterile environments, advanced anesthesia management, and immediate access to specialized equipment. If something goes wrong during surgery, a hospital has everything needed to respond immediately. Intensive care units offer continuous monitoring for complex surgeries. If you're having a major surgery, especially on your heart, brain, or other vital organs, you might spend time in the ICU afterward. There's also a middle ground. Ambulatory surgery centers. These facilities have operating room capabilities, but are designed for surgeries that don't require overnight hospitalization. They offer cost advantages while maintaining safety standards for appropriate surgical interventions. Overall, the setting selection involves multiple factors: your overall health status, how complex the procedure is, what type of anesthesia you'll need, and what the potential complication risks are. Healthcare providers carefully evaluate all of these elements to ensure that you are in the right place for your treatment. So let's talk about anesthesia because this is something people tend to worry about. Your anesthesia type significantly affects your experience, how you prepare, and your recovery timeline. Local anesthesia involves targeted numbing of a specific body area using injectable medications. Now, you're fully conscious and alert, you just can't feel pain in that particular spot. Procedures using local anesthesia include skin biopsies, wound repairs, and minor joint injections. Conscious sedation is a step up. This combines mild sedatives with local anesthesia to create relaxation while you maintain consciousness. You're responsive. If someone asks you something, you can respond, but you're relaxed and you experience reduced anxiety and discomfort. For instance, colonoscopies commonly use conscious sedation. General anesthesia is what comes to mind when people tend to think of being put under. You are completely unconscious. Anesthesiologists use intravenous medications and inhaled gas to keep you asleep, and they monitor your vital signs continuously while managing your breathing, blood pressure, and heart function. Most surgical interventions require general anesthesia for patient safety and allow surgeons to work with precision. And then there is regional anesthesia, which blocks nerve signals to larger body areas. Techniques like spinal blocks or epidurals fall into this category. This provides extensive numbness while allowing you to remain conscious. If you've ever had a C-section or certain orthopedic surgeries, you might have experienced regional anesthesia. The type of anesthesia you need depends on the invasiveness of your treatment, how long it'll take, and what will keep you the most comfortable and safe. So let's move on to recovery. Recovery is where rubber really meets the road because this is what will actually affect your daily life. Now, procedure recovery is typically straightforward. We're talking minimal downtime with same-day return to normal activities in most cases. You might manage some discomfort with over-the-counter pain relievers like Tylenol or ibuprofen. If you had sedation, there might be driving restrictions for a few hours, but that's usually it. Now, surgical recovery, that's a different story. Surgery requires extended healing periods ranging from days to months, depending on how complex the surgery was. Pain management often involves prescription medications. You likely have activity restrictions, things like lifting limitations, driving prohibitions, and time off of work. Wound care becomes a daily responsibility. You need to keep your incisions clean, watch for signs of infection, and follow very specific instructions about showering, changing bandages, and when to have stitches or staples removed. The recovery phases typically break down like this. There's immediate post-operative monitoring, which happens directly after your surgery. Then there's acute healing during the first week or two. And finally, there's gradual return to normal function over several weeks or months. Now, there's several factors that affect how quickly you recover. Your age and overall health matter. Younger, healthier patients typically recover faster. Surgical complexity is huge. More extensive procedures require longer healing. Compliance with instructions is critical. Following your doctor's advice actually accelerates recovery. Your support system matters too. Having help with daily activities promotes better outcomes. This is where you may consider hiring an in-home nurse to assist with care for a speedier recovery. An in-home nurse will ensure that there are no complications or recovery setbacks. All right, so you're sitting in your doctor's office and they're recommending some kind of treatment. What should you ask? First and foremost, why do I need this treatment now? Understanding the medical necessity is crucial because you're going to be going through a lot. So the better you understand why it has to happen, the easier it'll be to go through it all. What are my alternatives? There are usually multiple ways to address a health problem, and you want to know all of your options. What will happen if I wait or choose not to proceed? This will help you understand the urgency and the consequences. What do I need to do to prepare? This covers everything from medication adjustments to maybe even fasting requirements. How long will the treatment take? And how long am I going to be at the facility? Then consider questions about recovery and lifestyle. What will my recovery look like? What activities will I need to avoid and for how long? When can I return back to work? This is all practical information that you need for planning. What kind of support will I need at home? Do you need someone to help you, or can you manage independently? What are the warning signs of complications? Don't be afraid to ask these questions. Good healthcare providers welcome them because informed patients always have better outcomes. Let me close with something really important. I mentioned it a little earlier, but sometimes professional nursing care during recovery makes all the difference. Registered nurses bring specialized knowledge that can identify problems early and intervene appropriately to prevent serious complications. Post-surgical patients particularly benefit from professional home care during the critical initial recovery period. Nurses can monitor your vital signs, assess wound healing, manage pain medications, and recognize warning signs of complications like infections or blood clots. This expert oversight can prevent minor issues from becoming serious problems that require emergency intervention. Here at Nurse Registry, we connect patients with qualified nurses who provide personalized home care services completely tailored to individual recovery needs. These nurses understand the complexities of post-op care and work collaboratively with your healthcare team to ensure optimal healing outcomes. Whether you need short-term support during the initial recovery or extended care for complex surgical procedures, professional nursing assistance provides the expertise and confidence you need for successful healing. Many patients find the professional support allows them to focus on their healing rather than worrying about managing these complex medical requirements during the recovery. And honestly, there's something incredibly reassuring about having an expert right there who knows exactly what to watch for and how to help when something doesn't seem right. Look, we all know medical treatments can be intimidating. Whether you're facing a simple procedure or major surgery, it's natural to feel anxious or overwhelmed. But here's what I want you to take away from this episode. Understanding the difference between procedures and surgery empowers you to ask the right questions, prepare appropriately, and set realistic expectations. Like we said, a procedure is typically less invasive, requires minimal recovery, and gets you back to normal life quickly. Surgery is more involved. It requires more preparation, more recovery time, and may need additional support at home. Neither one is inherently scary when you know what to expect and you're properly prepared. So if you're facing any kind of medical intervention, use this information to have informed conversations with your healthcare provider. Ask questions, understand your options, and prepare appropriately. And don't hesitate to arrange for professional support if you need it. Your health is worth the investment of time and attention to do this right. Thank you for spending time with me today on Care Conversations. I hope this episode gave you valuable insights and practical takeaways that you can use. If you found this helpful, please subscribe and share it with someone who might benefit. Remember, quality care starts with quality information. And whether you're managing your own health or caring for a family member, you don't have to navigate alone. For more resources and expert nursing care, visit nurseregistry.com. But thank you so much for listening, and until next time, take care.